Hi, I'm Glenn Boyd, and I'm doing my cardiovascular assessment and my lung assessment for Health Assessment 1. I've already introduced myself to my patient. This is Peter. He'll be helping me out, and I've already done hand hygiene. And what I noticed was going into this cardiovascular assessment is that the skin assessment's part of it. So the skin assessment we did last week. So you're going to look for things like turgor, moisture, color changes in the skin, edema, things like that as part of your cardiovascular assessment as well. You're also going to palpate to feel for like temperature and things of that nature. Now, when you're palpating, you're also going to feel the different like pulses. So you're going to feel the uh, the radial pulse, the brachial pulse here on the wrists. You have your carotid up here, your femoral in your groin. There's the popliteal behind your knee. Um, there's one here. There's the apical, which is in your fourth or fifth intercostal space here, kind of under the pec. And that's where you listen to the apical pulse, and you're going to compare that to your other peripheral pulses and see how they sound compared with rate, rhythm, and volume, and things of that nature. Now, and other things that you can do, and you're gonna with the apical pulse, you're going to use um, your stethoscope, and you would listen to that area. Um, another Other areas that you would listen to are your aortic, which is going to be in your second right intercostal space, so right in here. And then you would move over to the left side for the pulmonic, and then you go down to your third left intercostal space, and that'd be your herbs. And then your fourth intercostal space is going to be your tricuspid, and then where your apical and your mitral would be is going to be mid-clavicular, that intercostal space, into the fifth intercostal space, right in there. And so that's where you would listen to your like heart sounds. So you listen for any murmurs, anything like anything like that. Um, so that's pretty much your cardiovascular assessment. You're going to check blood pressure, other things like that. Um, Also, I am sitting down lower because the lighting is bad in here, so it's hard for you to see my face if I'm standing up. So I am down on my knees doing this assessment. Um, uh, so that's the cardiovascular assessment. Next, we're going to go on to our lung assessment. So with lung assessments, first thing you're going to do is you're going to check the size and shape of the thorax. Pretty much with anything you're checking, anterior or posteriorly, you're going to want to check to see if it's symmetrical. Is it rising and falling symmetrically like this? Um, when you have surgery, is there anything like barrel chest where it's like poking out? Signs of like COPD, things like that. And excuse me, do they have a tachypnea, retractions, cyanosis, things of that nature? And this is another time when you do your overall respirations. So for your like, your 16 to 20, 12 to 20 actually for adults. Check on the uh, respirations. Now you're going to want to go and in each intercostal space, you'll percuss to hear some resonance, and you'll do that all the way down to probably the fifth or sixth intercostal space. And you want to hear resonance there. Um, you're also going to palpate, and you're going to use two fingers, and you're going to press on the chest. And if you hear any like crunching, like Rice Krispies, that could be crepitus, where the bones are rubbing together. And then the last thing you're going to do, where you auscultate, is so we're going to get our stethoscope again, and you're going to listen for a full breath sound right above the clavicle, and then you'll take a deep breath in, and then you're going to move over to this other side, and you're going to listen here, and then you're going to go to the second intercostal space, and you'll listen here, deep breath in, and you'll go over to the left side, and you'll keep repeating that down on each intercostal space, down to about the fifth or sixth intercostal space. And you'll listen to those, and you're going to do the same thing on the posterior side, except you're going to skip the shoulder blades, and you'll do right above the shoulder blades, and then you'll do under the shoulder blades on each side in those intercostal spaces. And that gives you a chance to check and make sure the uh, ribs are flowing downward like they should, like making sure those are aligned as they are as well. Now, what you're listening for when you auscultate these sounds is uh, any abnormal sounds, such as like crackling, wheezing, ronchi, things, because that shows that something's going on, like maybe there's fluid in the lungs, or there's an infection, or something like that. Another thing you can do is on the posterior portion, you can place your hands, your thumbs, next to each side of the spine and have them breathe in and out, and it should push your thumbs out and push them back in at the same rate. So that would be your cardiovascular and your lung assessment. Thank you.